Hello and welcome. This is the first mental health educational session for the new year for the rural mental health, rural minds, excuse me. I'm excited tonight about this program, but it's the Rural Minds Connections webinar series for 2024. And I'm Julie Lux. I'm the Vice President of Communications for Rural Minds. And one of the reasons that I'm particularly excited tonight is because we have a record registration for tonight's webinar. And I hope that everybody who registered is with us tonight. And for those of you who may not be as familiar with Rural Minds, I'd like to quickly tell you just a little bit about the organization. Rural Minds is a 501c3 nonprofit organization, and it was founded in 2021 by Jeff Winton. And if you haven't done so already, I would encourage you to go to our website, ruralminds.org, and you can learn a lot about the organization, many of the resources, great resources that the organization offers, like the one we'll be talking about tonight, but also take time to look at the video where Jeff tells his very moving story of how this organization came to be. So I encourage you to watch that video and spend some time at the website. But tonight we're going to talk about one very specific offering that Rural Minds has recently launched, and that is called the Rural Minds Mental Health Resilience Program. Now, one of the things that I think is very special about the Rural Minds organization is the fact that it's truly all about people who live in rural communities. It's looking at mental health from the perspective of those individuals. And one thing we know about a lot of folks that live in rural communities is that they pride themselves on being self-reliant and having a do-it-yourself mindset. And that is just exactly how this program was designed. It is designed as a toolkit, and it's absolutely free. Everything, all the resources that you'll hear about tonight during this webinar, it's all absolutely free, and it's mental health information that people can use to help to support mental health in their own communities. And, we're really excited. We're really pleased to have the good folks at the National Grange as our partners in this program. And you'll be hearing from the Grange a little bit later on tonight. Some of the folks who have already used this program will be telling us a little bit about their experiences and what they're doing to support their communities and their local granges. And then we will also give you a tour of the website so that you can see for yourselves how to find the information, how to access the information that is available to you and to anyone living in a rural community and is available there. But first of all, I want to do our annual disclaimer that we really are, and this is very serious, we are respectful of all of our attendees' privacy. And so you please be assured that we never show the names or the faces of the people who are attending, who are watching tonight's webinar. You'll look at all of us participants, but not the people who are watching. However, that does not mean that we don't want you to participate in tonight's program. We really encourage you to be a part of it by submitting your questions. There is a Zoom Q&A at the bottom of your screen. And again, your name will never be seen on the screen, but we love getting questions and responding to your questions. So please feel free, totally anonymously, to give us your question, and our speakers tonight will be happy to respond. And with that, I would like to introduce our first speaker, Susan Hanks. Susan, if you'd like to join us. Susan is the president of the Rio Linda Grange. She is also the CFO and treasurer of the California State Grange. And Susan is a small family farm owner and operator, along with her husband, Paul. And let me see if I get this. It's the Hanks, Hens, and All Things Good.
Yes.
So that's the name of your farm, Susan?
It is. It was the compromise.
It's wonderful. Well, you have had experience with presenting the program, so I'm going to turn it over to you to tell us a little bit about what you did and what you learned from it.
Well, thank you very much. I just want to say my participation has been very easy. It's been very simple. I went to the National Grange Convention in November of 2022 and saw the Rural Minds program presented. It was very close to my heart. I listened with great interest, understanding exactly where they were coming from and knowing that a little bit of effort from just about anybody can make a big difference in this. Came back to our home Grange and I tasked a member with finding out more. Go to the website, go to the Rural Minds website and see if you can come up with things to make a program. And let's do that in a couple of months and see, where it goes. The member came back to me and said, everything I needed was in one website. They have just a phenomenal amount of resources available. I can do this. I'm going to make a presentation. So we scheduled it. We had a pretty good viewing that evening. We had some young people in the audience. The person putting on the program spoke with the parents, made sure that they understood what the topic of conversation would be, that it would be in an understanding language. We had a really amazingly warm reception. There were a lot of emotions running high. There were a lot of people recognizing themselves, if not part of themselves, within the presentation that was made. At the end of the day, the evening left everyone knowing that we all appreciate everyone being here and that they're all loved and the world would not be a wonderful place it is today if they were not in it. We walked away from the meeting, sorry, and knowing that it probably touched a couple of people and maybe someone was going to get a little help, maybe somebody was going to help somebody else. But the week after, I had a person come to me who revealed that they were about to commit suicide. And that evening, they recognized themselves and they got treatment. They're still here. We live in a small town, so it's really hard to hear that things were going on that we didn't know. Which I think is often the case. And you certainly see that in the Rural Minds literature. I'm so thankful that we followed through and we did what we were asked to do. We are now currently within our Grange. I'm in a community that's roughly 10,000 people. We're on the outskirts of Sacramento. So we're not what a lot of people would say rural, but we don't really, well, we have a grocery store, but we're a food desert. We don't have a whole lot of services. So to see these kinds of things happen in this little community is delightful. This year, our program is laminating the literature from Rural Minds and putting it in every public bathroom in our community. I think that a lot of us who have experienced depression can see that we hit bottom and our safe place is a bathroom. So we're hoping that that will reach even more people, not just the ones that are coming to our Grange meetings.
Susan, how moving the fact that you really saw firsthand after your meeting that that this information can truly make a difference in someone's life. So was the overall response positive? Or you mentioned that you're continuing with putting things in the bathrooms, which is actually a wonderful idea on so many levels to get the word out. But has there been other feedback, other reactions since you had your initial session?
Part of the conversation was to normalize the conversation. And within our Grange, it is a safe place to discuss whatever you need to discuss. It might not be in front of the entire membership, but certainly if you need to say things, it can be said there. There's somebody there who will listen, and the conversation has been much more normalized.
Wow, that's wonderful. And I think that's one of the things that we talk about a lot is that non-judgmental ear of someone who's just willing to listen. And that's, sometimes, like you said, that's what an individual needs. So we do have a question here. Someone would like to know the person that you mentioned, who is able, were they able to find longer term mental health care? So,
Yes,
okay, so
yes.
you help them, and not because they had asked through this program, so not necessarily through this program, but you were able to help them find the resources that they needed.
It was a lot of that they recognized themselves and that they were going down a path that was not reversible. So we caught them, we helped them. They are still here. They are a very functioning member of society. I don't hear negative things like I did on the very first occasion. But I do get a check-in and I do overhear other conversations that the treatment is progressing and they are doing remarkably well.
Okay, that's wonderful. That's wonderful. I have a different question here. How did you publicize that first meeting? This person would like to know. And what was your title? How did you promote it to other Grangers?
We did not. It was a community Grange meeting. So we didn't put it out to the public. We don't generally do that. Our meetings are open to the public, but they tend to be people who are interested in joining the Grange. When we brought it up that let me back up. The membership didn't know it was coming until that evening. It was just an evening program that we were putting on.
Oh, okay. Okay. So that was why you would also reference back that the people who brought their children, you'd advise them what the subject matter was because they did
They
coming in.
yeah, they had a heads up.
Okay.
And we wanted just to tell those children under the age of 18, the parents, that this was what we were going to be talking about, and that, at what point in the evening it would happen. If they were uncomfortable, they could choose to either exit the room or exit the building. It was up to them, with zero hard feelings. You got to do for you what you got to do for you.
Of course. Of course. Did they stay?
Yes,
They did.
yes.
Good. Good. It's
And I hear the younger people today having the conversations when we're in public, that they're handing out the flyers when we have a community event. They are fully on board.
So you're continuing to hand out the literature because we have a person who wanted to know what kind of resources you had available at the meeting itself. Because, sometimes, especially in rural areas, clinicians, for example, are very hard to find. And if you can find one, they're hard to get into. So did you have those types of resources available?
No, we simply had the flyers with the QR code. We have the flyers hanging in our hall with the QR code. So when people rent it and those kinds of things, anyone coming into the hall has access to the same information, the Rural Minds website.
Okay, but they can get to the website through the QR code. And so there is a
Yes.
resource in that way. And we do have some of those types of resources, of course, available. This is a great question. How do you think having these conversations help to remove the stigma around the struggles with mental health?
Oh, that's a great question. Part of it is we're California, so it's an openish topic in this part of the country. It For people to have to travel to another community to see a doctor because we do not have a doctor in our community, it's very easy. You go into the city where you instantly become anonymous to see any kind of physician. The amount of therapy that's been done over Zoom in the last 4 years is not going to go away. You can have therapy on a screen just like we're having today and get help. And if that's the first step, or calling 988 is the first step, we're happy to show them how to do that.
Okay, but you talked earlier a little bit about just this whole idea of normalizing the conversation.
Right, right. So it's a come and tell me anything. And, we're a family, and family takes care of our own. And just because, if you have a stomach bug, you're ill. If you've got, your head having thoughts of killing yourself, that's another illness, and let's treat it. And there's no stigma here. I don't know if that's just the way I'm raised and we have such a like community within our Grange, but we all have everybody's backs. We help each other.
I'm going to take one more question and then we unfortunately have to move on because it's been great talking with you, Susan. But what has been your biggest takeaway from the event? And do you plan to host more?
I was so moved. I still, it's been a year and I still tear up when I talk about this. I'm so happy that I helped one person dramatically. I know that that evening there were 3 other people affected, not in a minimal way, but they sought better treatment. And the word spreads like wildfire. And if I was the one that lit the match, I didn't run the program, I didn't create the program, but I lit the match. And that makes me so happy that I just want to spread the word with the world and see success from other people lighting that match.
That is awesome. Well, thank you. Thank you for everything that you do and to all the good folks at the California Grange. We appreciate your time tonight and keep us posted on what's happening in the future. So thank
I
you
sure
very much.
will.
Thanks, Susan. Thank you for being with us, Susan Hanks. And now we're going to start that aforementioned tour of the website. And joining me now is the Executive Director of Rural Minds, Chuck Strand. And he's going to talk to us a little bit more about the Rural Mental Health Resilience Program and how every one of you watching can take advantage of these great resources. Chuck?
Well, thank you, Julie. I appreciate that. And also thanks so much to Susan, because we know that in many cases, people are more comfortable receiving mental health information from somebody that they know and someone they trust, especially in rural communities. So Susan, again, sharing your experience as a trusted source for mental health information in your local community, that's amazing. And just in taking the lead for creating that meeting and with the program materials to discuss suicide awareness and prevention, obviously life-saving. So the ripple effect of what Susan has done and what we all can do is really inspirational. So hats off to Susan, and hopefully she's inspiring a lot of folks to, do something similar. And it's very gratifying to see the partnership between the National Grange and Rural Minds serve as the foundation for developing and launching the Rural Mental Health Resilience Program. As Julie mentioned, the goal of the program really is to empower folks across rural America with free access to relevant information and resources so they can be part of the solution to improving rural mental health in whatever way suits their needs and interests. And so again, Susan shared a powerful example of how she chose to use the program materials, and Dave will be sharing his experience with the program in a few minutes. But there are many other options that can include something as simple as confidentially visiting the website to learn more about a mental health condition, or printing a flyer to post on a cafe bulletin board to raise awareness for real mental health crisis and the materials provided through the program. Or even, just tips on how to start a potentially uncomfortable conversation with someone you think might be struggling with a mental health challenge. We'll look at some of those programs. So let's just log on to the webpage and access some of the free resources. Okay, so here we are at the Rural Minds main webpage, and we have a banner here that is a direct link to the program. It can also be found under the programs here of Mental Health Resilience Program. So as we enter the webpage for the program, we want to say thank you, of course, to our sponsors and our program distribution partners. And while it's important to recognize the facts and the statistics that validate the rural mental health crisis, the focus of this program really is on providing hope through improving the mental health in rural communities across the country, and through these information and resources, this toolkit. So As we can see here on the layout of the web page, the table of contents on the right breaks down the information into different sections. There are 4 sections. Under each of these bolded, capitalized sections, these are links to that part of the web page. And that's where you can access each of these documents in the toolkit. So we've got the facts about rural mental health, which includes mental health conditions fact sheets, talking about rural mental health, hosting a rural mental health event, and then access to free resources that serve like a portal for comprehensive information. We also want to call out the fact that we are really looking for input from all of you. This program is really meant to be a dialogue, a back and forth, and this is just the beginning. So we want to keep building on the resources that we have here. So we have 2 opportunities for you to provide feedback. One is anonymously by putting in your comments here and just hitting submit. The other is for you to send an email to us at info@ruralminds.org. So just to show you how this works, so here's the top of the section 1. But if we go back up here, we can click this, and it takes us right back to that section there. So again, this is the facts about rural mental health. And all of these materials are downloadable, they're printable. So we'll just kind of give a quick overview of some of these in this section here. So the program flyer, it can be printed, of course, in color or black and white, but this is just sort of an overview of what we're talking about right now. You know, what's the Rural Mental Health Resilience Program? Identifying the fact that there is a mental health emergency, but we don't want to leave it at that. We want to identify the problem, but get into solutions and how we can all be part of making an improvement in rural mental health. And so this describes just some of the free materials in the program. And again, 988 is so important to remember that 3-digit calling number if someone is in crisis or just has a question. And then it kind of walks you through how to get started. So you can access the free materials either through the URL or the QR code. You're free to download and print whatever you like, as many quantity in terms of numbers of pieces of each or many pieces, and then either just review them on your own or share them with other people in your community. This provides more information on what we're talking about as far as the statistics, the facts about a mental health crisis that we're experiencing. And rural America includes 46 million people. And there's just a lot that, there are challenges in terms of that really kind of lead to some of these higher percentages of suicide and depression and anxiety. There's a shortage of primary care providers and just mental health providers in general. So that really is a major concern. And then a lot of us take broadband internet for granted, but it's non-existent or unreliable in a lot of parts of rural America. So those are some of the things that we talk about in that sheet. And then we have the lifestyle barriers that are part of challenges for getting mental health assistance in rural communities. And a lot of that is based on stigma. So people don't necessarily understand or recognize that mental illness is an illness, just like cancer or diabetes or heart disease. And instead, since it's not visible in terms of physically visible, at least not many times it's not, people don't really understand it. And sometimes it's perceived as a character flaw, a personal weakness. And that, what Julie mentioned earlier, as far as the independence and people not wanting to ask for help, that can be a barrier, but this program is really designed to meet people where they're at. And if they want to do things themselves specific to being part of the solution for mental health and improving things in rural communities, we want to provide these materials so people can do that. But some of the other challenges just include, being in a small town can be a great thing, but it can also be a challenge in terms of potential lack of confidentiality and just, the lack of access to care that might be nearby. So talking about mental illness is really the best way to break down the stigma. The conversations we're having right now, the story that Susan shared, the conversation that Dave is going to recap in a few minutes, all this is just so important to actually have the conversations in rural America and to let people know it's okay to talk about it and it's okay to look for help. And if they want to do so confidentially, that's fine to go on the website, and this is a good start. So again, it's just, many people have the ability to share a personal tragic story, such as Real Minds founder and Chairman Jeff Winton, and that's Julie mentioned that video on the Real Minds website. Not everybody's able to do that. It's highly admirable when someone has that courage to share something as painful and personal. But even if that's not the case, just talking about mental health and the challenges that are out there is really a big step to breaking down that stigma. There are a lot of myths about mental illness and suicide. I won't go into all of these, but I think one thing that's important to call out, and since Susan was talking about, suicide awareness and prevention, some people think that talking about suicide, myth number 3, is going to, kind of put the idea in people's head as far as that might be an option. But that's research proves that's really not the case, and it's so important to talk about suicide, especially if you're speaking with someone who might be having suicidal thoughts. But oftentimes people who are in a dark place might welcome the opportunity to talk to somebody because they feel isolated and alone. So that's there's not necessarily a right way to talk about it, but it's just important to talk about it in whatever capacity is appropriate. And this is specific to suicide awareness and prevention, and a nice snapshot of some of the things that are important as far as warning signs and what to do if you suspect somebody might be suicidal. It also includes a link here to the program that Susan referenced, and this is all about suicide awareness and prevention. Really great information, comprehensive. We have 2 recorded webinars. One is the actual training session for suicide awareness and prevention. A lot of these links circle back to the page we were just on because we want to make sure that we cover everything comprehensively. But this is a new piece here that we have too, with the Q&A, or the frequently asked questions, excuse me, about suicide and prevention. So a lot of great information. And I won't go into all these fact sheets, but I do want to call them out because they're really very, very helpful, because there's a lot of people, it's tough to find a comprehensive but succinct, 1-page double-sided document that talks about all these different mental health conditions. So we have bipolar disorder, generalized anxiety disorder, major depression, schizophrenia, substance use disorder, tardive dyskinesia. So I'll just click on one of them just to show you, because they're all structured the same way, and it's meant to just, again, provide a quick snapshot of information that's relevant to each condition. But it starts with the definition. In this case, what is depression? What are the symptoms? How common is it? How do you diagnose, in this case, major depression? And then how do you manage it? How do you treat it? If you have this condition, how do you manage the condition and live a productive life? So each of these also includes information for more information that links for more information that provide resources, support groups, whatever it might be that's relevant to each of these. And then in section 2, we talk about real mental health, and we provide tools that can help start those conversations. I referenced this earlier as far as the conversation starter. And talking with someone about mental health can be awkward or uncomfortable, and we recognize that. But just to help get things started, again, it's so important to have those conversations, because we can't really make things better until we start talking about them. So here are just some tips on how to start the conversation about mental health, questions that might ask. Of course, these are just suggestions. Take whatever works for you, revise it, update it, or just use it as reference and do what you think is going to work to accomplish whatever conversation you have in mind. And there's some additional tips here as far as like how to set the stage for a conversation and what to do with the information. So it's again kind of a starter on helping to get those conversations going and to talk about this important topic. So I'll stop here, and later on in the presentation, Phil will continue on with reviewing or highlighting some of the content in section 3 and 4.
Thank you, Chuck. And I think that that was a good demonstration of the fact that there's a lot of material and a lot of great resources that are available. And I've got a couple questions for you before we let you go. First of all, one is to keep me honest. This is the materials that are up there now, we are going to continue to add to them as appropriate. And so this is what we call in the biz a living, breathing document to some extent.
Exactly. And that's why we're so important. It's so important for us to get feedback from everyone on this webinar and folks around the country to really help us to be sure that what we're developing, what we can add is really relevant, because it's all about the people we're serving. We want to make sure that we're providing information and resources that are relevant and helpful. So please let us know what we can do better, what you think we're doing well, but more importantly, what we can do to add more information, because that's really what it's all about.
Awesome. And I also have a question that I want to, I've got a bunch of questions. We'll take some of them later, but one was, are the fact sheets and brochures available in other languages other than English? This is a person from California, and they said it would be very important when they're dealing with the farming communities, like Susan was talking about earlier. Will there be other language documents available?
We don't have that yet, but that is something that is definitely at the top of our list, because we recognize that it's important to have the materials in Spanish and potentially other languages also, but specific to the agriculture community, that would make be very helpful. So we're working on that.
Good question. Okay, Chuck, you're going to stick around because we may have some more questions later on, but right now we want to get to Dave Roberts, and we've covered Susan out on the West Coast, and now we're going to go all the way to the East Coast, because Dave is the president of the Riverton Grange number 169. Okay, don't laugh at me if I mispronounce this now, Dave. Barkhamsted, Connecticut. Was I anywhere close?
Barkhamsted.
Barkhamsted. Accent on the wrong syllable. Okay, we are delighted to have you here. You said that it says here that this Grange was chartered by your great grandparents. So you've been involved with this even before you were born. So, and in addition, Dave also serves as vice president of the Mountain Laurel Pomona Grange number 15, and is a lecturer for the Connecticut State Grange, and serves as the inaugural at-large fellow for the National Grange Shipmates Program. So Dave, welcome. Thank you so much for being with us. Tell us what's going on in Connecticut.
Well, Julie, thank you for hosting this program tonight, and thank you for inviting me to participate. I really appreciate it. And I have to tell the attendees, you're really the smart ones here tonight that I hope will learn from some of the experiences that Susan and Chuck and Phil and I are able to share with you about the valuable information that's available free of charge. As Julie mentioned, I am from Connecticut. My family first came here in 1629. I'm the 12th generation. My great-grandparents were two of the original 32 charter members of Riverton Grange number 169. Like many people in the rural parts of our country, we're self-reliant. We try to be independent. We try to do things on our own. Fortunately, I'm retired now, and my very first boss was Senator Lowell Weicker from Connecticut, a United States Senator. And I remember going into his office in Washington, D.C. for my interview, and our conversation went something like, he asked me, is there anything you want to talk about while you're here? And I said, well, I'm interviewing to be a health aide on the Senate subcommittee on the handicap. How do your constituents get into your office? There's no accessible entrances into this Senate office building. And Senator Weicker said, that's a great question. And he said, someday we're going to have a law that are going to make all federal buildings accessible, and we're going to build a new Senate office building, which became the Hart Senate office building. He hired me on the spot, and I tell this story because it's so important to have conversations and to point out what the facts are, and to try to help people understand where you can see change to be made. So I belonged to the National Grange for almost 50 years. I joined when I was 14 years old, and it's been a great experience. I mentioned that throughout the Grange and now their connection with Rural Minds in this great collaborative partnership. So much has changed to add resources for all of us that live in the rural parts of our nation. I first became aware of Rural Minds in 2022 when I was at the National Grange Convention in Reno, Nevada. And I went to this session, and the founder and the CEO of Rural Minds were both there, so Jeff and Chuck. And I have to say, it was the most mind-blowing seminar that I think I have had in decades. It really got me thinking about the impact we can have partnering together on something that's really not talked about, mental health. And so after I left that session, I was flying back to Connecticut, and I was thinking, how can we have an impact? I'm the program director for the Connecticut State Grange. They also call it the lecturer, state lecturer. And so I thought, what can we do? So one of the things we decided to do was partner with another nonprofit that's involved in service here in Connecticut, and that's Lions Clubs International. We set up a specialty club focused on mental health. We had to get special permission from Lions International to call the club the 988 Lions Club branch. And we wanted 988 in that title to make everybody realize what 988 is and the importance of everybody having the understanding to call that number if they need it. So we started that club. We then recruited many of those people, either from Grange or from Lions, to come together, and we began to take sessions, seminars to our various Grange halls. One of the things we're blessed in the Connecticut State Grange is the ability to get grants to do educational programs at our agricultural fairs. So at least 2 Granges here in Connecticut applied for a grant to put on an educational program focused on mental health awareness using the tools of Rural Minds. And so I first became aware of this new enhanced toolkit and all that's available there. And what I like to tell people, it's really one-stop shopping. All the information you need is there free of charge. You can surf it when you want. You can pull out what you want. So what we did for the 2 seminars that we put on here in Connecticut, we pulled down fact sheets that we could distribute. We put together some goodie bags for folks to provide resources to them. We used some of the marketing material to advertise that we were doing this in the community because we thought it was important not just to do it for Grange members, but for others that really wanted to learn and see what is available. I mentioned at the beginning of my remarks, my career. When I worked on the U.S. House Appropriations Committee, I had the opportunity to work with Representative Patrick Kennedy. And for many that know, he was a congressman from Rhode Island, and he was a champion of making sure that mental health was on parity with physical health. And I think that's what this toolkit helps us do. It helps us. We all know about many things physically, but we don't know how to address some of the mental health challenges, how to start those conversations, what the facts are, letting people know in the rural areas of our country how much higher the rates of suicide are in the agricultural community than any other way of killing someone. So it's so important that we get this information and we share it. So again, this is one-stop shopping. It's free to use. I highly encourage you, go through. Chuck started showing you what the toolkit is. There's going to be more information that Phil Veneta is going to be showing you, but take advantage of it. Learn. If you have a Grange, a state Grange in your state, go to your program director, see if there's someone that can put on a program on this. If there's not, you can reach out to one of the shipmates. There's one in every region of the country, and they can bring educational material focused on this. But as our National Grange president, Chris Hamp, has been so fond of saying, we have to keep pushing the envelope. And I know she, as our president, wants to continue this great relationship that we have with Rural Minds. And as one of the National State Grange lecturers, I want to thank Rural Minds for partnering with the Grange to get this critical information to everyone.
Well, it is indeed a terrific partnership, Dave, and we already have a lot of questions for you, but I'm going to start with mine. You referenced the shipmates. Can you tell us a little bit about what the National Grange Shipmate program is?
Certainly. Last year, the National Grange wanted to have a program, a fellowship program focused on leadership and membership expansion. So there's 5 regions in the National Grange. I live in the Northeast region. So a Grange member applied, and the state Grange president selected one in each region. And then out of those 5, they selected one national at-large person. I got that national at-large slot focused on membership. So it's a 2-year process. We're advertising right now for our next second-year class of shipmates, but it's a great way to expand and work with Granges throughout the region of your country if you're interested in promoting leadership and membership and how to really expand National Grange opportunities for all people.
Oh my gosh, that sounds wonderful. A very quick question here. Somebody wants to know what was in your goodie bags.
So in the goodie bags, we had some fact sheets. We had some magnets that like refrigerator magnets that dealt with mental health services. We put in a pad, so if people wanted to jot down kind of thoughts and things, but just for themselves, we had a pen and pencil in there in the goodie bag. But we put in some different things that we thought would be useful for them. And we created this for both the Granges that I happen to attend the program for. And it really made a nice opportunity. After the people left, it gave them something to focus on and to really, rethink about what was going on. And could they use this information for themselves, for a family member, or for a friend? Because as Susan mentioned, you never know who you're going to be impacting by getting this information out. And I know when Chuck called and invited me to participate, as Chuck knows, I'm very busy like all of us, but anytime we have an opportunity to share this great one-stop toolkit to get the message out, as you mentioned, we have a huge attendance at this. I think you said a record-breaking attendance at this webinar tonight. But all these people now are going to have this information from Rural Minds that they can now take out and spread. And it starts with one and it keeps spreading. So with Jeff's family situation, that terrible death, but just look at the impact that has had now on so many people and how many lives it has, how many lives it has truly saved.
That brings me to another question. What was the reaction? What was the repercussions, I should say, of the session that you presented? How did it go over well? What were some of the things that happened post-session?
Right. So first of all, I actually was not the presenter. One of our new members that both wanted to be a Lion and a Granger joined together, and they went and got training, and they actually put this on because they had a passion of bringing this down to the high schools. We were coming out of the pandemic, and this was a woman that was very active in our region. And when I came back and started talking about the tools that were available and the opportunities to share information, she jumped on this. Her name is Kim Becker, and she belongs actually to Granby Grange number 5 here in Connecticut. And she has been taking this program, and it's really her vision to continue expanding it. And I know Susan talked about, the sensitivities of younger people, but trying to have conversations with people that really were isolated for a while while, and now they're back in different settings. How do you have conversations? So Kim's been working with the schools, and then I volunteer in the seniors community, which is another community that really needs this information, because many people, the 70, 80, 90-year-olds, they're so self-reliant, they're so independent, they don't want to, and you've got to figure out a way, how can you talk to them sensitively and let them know that there's information available?
And help available too. Um, Again, you're doing a great job of giving me great segues into these questions, Dave. Somebody commented, they said this program sounds a little intimidating. Do you think hosting this kind of meeting is something that anyone could do with the proper materials?
I would say yes. As I mentioned, when I came back from Reno the first time, and then Niagara Falls was the next annual conference where Rural Minds again had a program at there, and they also had an exhibit in our exhibit hall. One of the things about this material is it can be used by anybody. It can be tailored by anybody. I liked the question about the different languages, because Connecticut, since I grew up here and my family first came here, is so diverse now. We actually have close to 4,000 people here from Nepal living in Connecticut. And we have a lot of people, I think, that would be willing to help translate documents, because so many different languages are spoken now and utilized. And so I think that's a great thing. But is this intimidating? I think if you take time, look at the information that's in this toolkit, it is not at all intimidating. And when you just think of that one person, that one life that might have been saved because you did this. I think that's why so many of us are passionate about this great partnership between Grange and Rural Minds, because we really are making a difference.
And we are very grateful for the partnership with the Grange. And Dave, if you will stay with us, because we're going to turn to our friend Phil Venata at the Grange, because he's going to talk. Again, this kind of ties into what we were talking about with the resources to help people put together those programs. So Phil's going to do a little bit more touring of the website and tell us about those resources and how people can take advantage of the toolkit and the material that's in it to create those kinds of sessions and make it less intimidating. So Phil, I will happily turn it over to you, sir.
Awesome. Thank you, Julie. I do want to first point out by saying that all of the materials we have available, they don't have to be a full program. Everything that's available on the Rural Minds website, and even here in the Rural Mental Health Resilience section, is usable as a one-off and can just be a resource for you to get the conversation started, the way that Susan was talking earlier about destigmatizing the conversations. The whole point of this partnership, the whole point of Rural Minds, is to just get those conversations going and finding a way to be more comfortable having these kinds of conversations. What we're going to talk about here is sections 3 and 4 of the Rural Mental Health Resilience website. So I'm picking up right where Chuck left off, and I'm going to go through this pretty quickly so we can end right at 8 o'clock on time. But this section 3 is really about hosting the event. And this is kind of your step-by-step guide to making it less intimidating. We start with an event planning roadmap, which lays out from week 8 all the way through the day of the presentation of certain steps that you should follow to ensure that you're hosting the best kind of event for your organization. These are not just for Granges. If your church wants to host it, if your Lions Club, like Dave was talking about earlier, wants to host one, your 4-H, your FFA, your senior group, whoever wants to host this kind of meeting, these materials are there for you to use and for your benefit. And one of the things that I want to hear, as I'm one of the people who was behind the creation of these, is what more do you need to feel like you're not wading in deep waters and being overwhelmed by this program. The reason I'm not jumping to these is because they're Word documents when they download, which is hard for me to bounce back and forth on my screen. So I'm just letting you know that. The key messages for a community talk gives you a step-by-step talking point for your way through this program if you wanted to host the full program. And even if you don't want to do a full program, it gives you the talking points just to get through certain aspects of the conversations. Who is Rural Minds? Who is the Grange? What are we working to have in these conversations? I'm going to jump straight down here to the sample event brochure because this is editable, and something that you can use to highlight this program when you host it. So there are several editable text boxes here. And I will say, if you're not computer savvy, if you don't have access to certain subscriptions or Adobe or anything, these are also very easily downloadable as just regular PDFs that you can print and handwrite in, or get some label makers and slap labels on these brochures, or work with somebody who has these kinds of resources for you. And inside gives you the option to talk about Rural Minds, about the National Grange, and about this program. On the back or on the front, what I would recommend in these sections here in the box that would be the front is to say where, when, and who is hosting the organization, or hosting the program, I mean. On these sections would be to talk about your speakers or a rundown of the program or your specific organization. You know, we have about the National Grange on the back, but if your community Grange is hosting it, this is a great time to talk about your community Grange too. And these are great materials for you to put out in advance of the program. Jumping back, the media alert and media release, I am going to jump to these really quickly, because what this is what I call a Swiss cheese press release, where everything that's highlighted in yellow is easy for you to edit yourself to be able to send out to a press publication, an organization like news channel, your local magazine, your local newspaper, that you can personalize these for your organization and for your specific event. Go back here. So moving down, so that's the media release. There is one specifically for Granges and one for other organizations. Take a look at both of them, grab the best elements from each. If you ever want to reach out to me to ask for other details to put in, or your state communications director if you're working with a state Grange, those things are certainly helpful as well. The interview Q&A template is a really great resource. Even if you're not holding a formal event and you're not doing an interview, this is a fantastic resource for learning more about how to talk about specific aspects of this program, specific aspects of dealing with mental health in rural America. And if you are doing an interview and you're perhaps being on the news, this is a great primer for you to get those talking points ready so that you're as comfortable as can be leading into one of those things. Let's see, the social media graphic. This is a standard one that you can use on Facebook, Instagram, Twitter, LinkedIn, wherever you're advertising. And then there's also an editable one, which gives you the spot to drop in any information that you have, or you specifically want to share about your specific program. And then we also have a website banner graphic, which is very similar. A yard sign, this is something that you can download and edit. It is quite a large file, but you have the option to, again, type in this section about your event. So if you have a budget for an event, and I realize a lot of organizations don't have a large budget for hosting these kinds of events, but these are the kinds of things that can really help you stand out and make this event as big and successful as possible. And then the last thing here is this editable event flyer, which has 3 editable sections in it. One to type the name of your organization, one to type in the details, and one for contact information if somebody wants to learn more. I would suggest just dropping an email address there or a phone number so that somebody can get in touch to learn more about the program. And these are the materials right now that we have to help promote your program. And if there's something, like I said earlier, that you are missing, please let me know, and we'll see what we can do to make it possible to get up here. And then the last section, section 4, are these free mental health resources. Some of these are printable that you can take to your event. So I like the crisis resource one. This is a printable program. And if you have a Grange Hall, if you have a church, if you have a bathroom stall like Susan was talking about earlier. These are great things that you can print and have available and ready to pass out, just have on site for your organization so that when somebody is in crisis, they know where to turn. Post it on community bulletin boards, post it in your local Starbucks and Panera, these kind of places where people are often looking at those bulletin boards, whether you believe it or not. It is somewhere that people are looking for information, and you never know when you're going to find somebody who needs help in that moment. So these are some mental health crisis resource, talks about NAMI, talks about the domestic violence health line, 988, of course, a big one that we've talked about before, RAIN, these organizations that are there 24/7 in most cases to help when somebody's in crisis. Then there are two other links that just take you to pages of the Rural Minds website. This first one is mental health resources by topic. I saw somebody asked earlier about alcohol abuse disorder, and that is on one of these. I think it must be on the next one. But these are organizations that provide specific help by the topic you're looking for. So if you know somebody who's dealing with bipolar disorder, you can direct them toward the Depression and Bipolar Support Alliance. These resources are here for you to use to help guide these conversations. And then the last resource here is Mental Health Resources A to Z. And this is the one that talks about alcohol awareness and Alcoholics Anonymous and substance use disorder. So these are, again, just more organizations for you to help direct people to. So that's a crash course tour as I'm batting cleanup on this webinar tonight. So Julie, I'm going to throw it back to you.
Oh, Phil, stay with me.
Oh, I'm staying here. I'm here.
Okay, if Chuck and Dave want to join us, we are, getting short on time, and we're very serious about getting out on time. But I do want to throw out a couple of questions to the group before we conclude here. One person asked, and give this to you, Phil. Are people allowed to place their company logo on the flyers and brochures?
Yeah, absolutely. So the Grange logo and the Rural Minds logo should stay there since we are the main sponsors and the leaders of this event. But if you want to put your company logo, your organization's logo on there to let it know that it's also sponsored and endorsed by you, if you're the leading voice in your community, then make sure that your community knows that you're behind it as well.
Very good. Somebody also asked, where do you find speakers? Are there local, and how many speakers, should they be local, and are there, how do you find these folks, and how many do you need to have in an event?
Honestly, one speaker's usually enough at an event. If you have a host as well, somebody from the Grange, but you can reach out to a local clinician. Your NAMI organization, NAMI, the National Alliance on Mental Illness, is in many communities around the country. And they might be able to help you. Local hospitals would be able to point you toward a therapist or behavioral health specialist who might also be able to come and talk. I think what's important for a speaker is finding somebody who knows your community too.
Very good. Very quickly, because I have a couple of things I want to mention, but someone asked about partnering with rural schools. Is this something that, because we know that young people are such an important audience, is this anything that the Grange and Rural Minds are planning or doing right now?
I'll throw that one to Chuck.
I'm gonna say I can jump in. I think the materials that we have right now on the Rural Mental Health Resilience Program would be appropriate, but we are looking at developing a program specific to rural youth mental health, and that's such an important segment of the population that is at high risk for mental health challenges. And so we definitely wanted to have some materials specific to that group, but I think a lot of what we have right now would still be applicable.
Awesome. Well, we know these resources are going to continue. But thank you to all of you for your participation tonight, both those watching the webinar and our great speakers here. But as we close, I do want to remind everyone that you will be receiving a survey. It can be anonymous, but it's very important, the feedback that you provide, because that is how Chuck and Bill and everybody get information for the next sessions that are coming up. So please fill that out. Again, thanks to all of our speakers. And Rural Minds is we are a not-for-profit organization, so donations are greatly appreciated to keep this important work going. And finally, I want to remind everyone that we have another webinar, I should say, coming up the first week in May, which is also Mental Health Awareness Month. It is sponsored by Teva Pharmaceuticals and Neurocrine Biosciences, and we will be talking about managing tardive dyskinesia. So the exact date of that will be announced shortly, both on our social media platforms as well as on our newsletter. So if you're not getting the Rural Minds newsletter, please sign up for us and follow us on our social platforms. And with that, thank you to everyone for attending. Have a great evening.